This video is regarding testing in nursing homes and assisted living during surge conditions. I recorded this April 15th, and during this time we have had many cases in multiple nursing homes around the state. The COVID action plan for nursing homes and assisted living consists of three components: the prevention components, that includes universal masking. The second component is surveillance and detection of the first case or cases to avoid an outbreak. And of course, the last component is containment of those first cases. When we test mildly symptomatic patients, the chances of a positive test are much less than when we test severely symptomatic patients. Due to that fact, the academics have not recommended testing of mildly symptomatic patients because the goal is to use the scarcely available tests to catch as many positive cases as possible. In congregate settings like nursing homes and assisted livings, our goal is not to catch as many cases as possible. Our goal is to catch the one case, the first case, before we get an outbreak. The next issue I want to discuss is the mass testing in facilities. This is being done after the CDC starts an action plan in facilities with multiple cases. Right now, the threshold is being lowered for mass testing. However, I think my colleagues need to be aware that mass testing doesn't alleviate the need for low threshold testing even after the entire facility has been tested. So if we have new cases with mild symptoms emerge among the staff and the residents, we should be testing those for the same reasons that we tested them before the mass testing. Testing of asymptomatic exposure cases among staff and resident is not yet recommended by the national or state CDC. We hope that as tests become available and we are told how many tests we have available to us, we would start doing that as soon as possible. Thank you and be safe.